Why should I go see a doctor if I feel healthy?
Will changing my diet now make a difference?
What's the screening for diabetes like? Is it gonna
What
hurt?
chronic conditions should I get screened for?
Why is it important to have a primary care doctor?
What would happen to my body if I don't manage my diabetes correctly?
I believe that we are so devoted to our patients and our loved ones that we're so busy that we basically don't take good care of ourselves. And it's incredibly important that we take care of ourselves.
This is important for healthcare workers because of the fact that we are the front line of healthcare. We need to know what to be prepared for and also how to protect ourselves from these things.
As a healthcare worker, we are so busy in our schedule that we forget to take care of ourselves. We're so busy taking care of other people. Okay, so we put ourselves on the back burner.
There are many people who just don't make time to go to the doctor, and they don't fill their prescriptions in time, they don't go back to get a refill, those kinds of things. So the benefit fund will end up paying for an emergency room visit or for stronger and more medications. If that member had stayed in touch with their doctor and followed the doctor's advice, it's entirely possible that they would be feeling much better right now, and more benefit dollars would be available to spend on their own and other people's health.
If we ourselves would get to the doctor on time, like we tell the patients to do, have your checkups every year, we can stop a lot of things. We can stop a lot of medications that we're on.
As a healthcare worker, I see this day to day. We don't take care of ourselves. I mean, what are we going to look forward to? That's the most important thing right now for me and my wife too.
We at the Benefit Fund are here for you, and that's why we developed the Member Choice Program, because we know how important it is for members to develop a strong relationship with a primary care physician. When you're in the Member Choice Program, you select a hospital network, and then you select a primary care physician within that network, so that you don't have to make guesses about where you should go for the best treatment. Your primary care physician will know you and know what's best for you.
To 12:30.
Dr. Lantigua is a wonderful physician. He's one of our over 20,000 participating physicians in our Member Choice Program, but he's much more than that. He's a very prominent physician in the field, and he knows us. He's very committed to 1199 SEIU members.
You should have your own primary care physician where you take your time, you sit with that person, and you express to him or to her all your concern about your health.
It is also crucial to remember that the doctor is your partner. There are no stupid questions. Ask every question that is on your mind.
Why should I see a doctor if I feel healthy?
What is the point of getting an annual checkup?
Well, annual checkups are important because today we know that there are illnesses that we can prevent according to your age.
Preventive health care is really important. It's like a tune-up for your car. Your car breaks if you don't do tune-ups. Our body breaks also if we don't do the maintenance.
I think it's very important for us to realize that we shouldn't take those illnesses that we're taking care of for granted. I used to see the things that are happening, and I used to even try to think that it's not going to happen to me because I don't fit the age group of the patients that are here. But what I have learned is a lot of those conditions I've started from a much younger age.
What would happen at an annual checkup?
In an annual checkup, the doctor is supposed to do a complete physical exam, the eyes, your nose, your throat, palpate your neck for lymph node and the rest of the body. Listen to your heart to see if there's a new sound in your heart. Listen to your lungs to be sure that they are clear. In the annual checkup also, we monitor your blood pressure. We discuss with you how your habitus is changing, how your weight is changing. We discuss with you the physical activities that you are supposed to have. I mean, that it's important to have an annual checkup because it allows us to be ahead of the game.
How should I be prepared? What questions should I be asking to my primary care doctor?
And what do I need to do before I go see this person?
It is important to really have all your questions and concerns about your health written down.
That means that you are in the obese category. And what we would like to do,
You need to understand what all those tests are. You need to know what those numbers are when the doctor tells you what the results are. Just knowing that the result was normal is not enough. Know your numbers. Know what your blood pressure level is. Know what your cholesterol level is. What's your good cholesterol? What's your bad cholesterol? What does that mean to you? What's your sugar level? Is it in borderline and you were just told it's borderline, it's okay? It might not be okay. You need to be able to communicate freely with your doctor. This is really the key to success.
you have to let that person know if you are taking any medications. You have to let that person know if you are drinking. You have to have that person know if you are smoking, if you are using drugs, what kind of medical conditions do you have.
So you need to be actively engaged. And again, it's a partnership that you have to have with your doctor. Don't just take all the information in. Ask questions.
When am I gonna know whether I go to a specialist or a primary care physician?
The primary care physician is like the quarterback. If you see at a football game, or if you like baseball, it's like the manager. And the primary care physician is the person that's in charge of your total health. If you need to see a specialist, it will be the primary care physician that will detect any illness that will refer you to the specialist.
We really encourage you to develop a relationship with a single primary care physician who's going to know your whole history. A coworker might be very wise and very smart, and indeed sometimes we share solutions to things that are very helpful to each other. But that doesn't substitute for having a relationship with a physician who really knows about all of your conditions.
I followed some tips that he gave me, and I was telling him how I live my lifestyle, and I do recommend an annual checkup.
Thank you so much, Dr. Lantigua.
I will encourage all my fellow members to go to their doctors and make their appointments and feel comfortable at it.
If we don't do certain screenings and consult the doctors, we are neglecting our health.
By members taking care of themselves, they're going to be happier, healthier, and plus, look at the joy that you're giving to your family to be around for a long time to come.